Happy Wednesday. It's hump day. Let's talk today about congenital cytomegalovirus. So 40,000 newborns are affected with congenital CMV in the US every year. And typically when that happens, a mom might be at the hospital and the pediatrician may come to her bedside and express some concerns for CMV. Or, it's been 6 weeks or a little bit more and they're noticing, maybe mom or dad or caregivers noticing that the baby is kind of having some spasms or spells or not tracking, the eyes are not moving correctly. And so when that's brought to medical attention, one of the questions we're going to ask is, is there about CMV? Now, the good news is that 85% of babies, newborns with CMV infection will not have any symptoms, but 15% may have some long-term symptoms, such as seizures, eye problems, small head. Now, CMV is very common. It's a virus. It is in the family of herpes virus, but it is not a herpes virus. And 1 in 3 children will be infected with CMV in the first 5 years. And by the age of 40, about half the adults will have an infection or have been infected, sorry. So, you're pregnant, you're concerned, what are the things to look for? Well, first of all, screening is not going to be recommended. So if you do go to the doctor, there's a good chance that your doctor is going to tell you, well, unless you have symptoms of fever or viral complaint, then they're not just going to screen for CMV, just to screen for CMV. There are a couple of things. If you do have symptoms of a viral etiology, then the next thing to do, you have to kind of wait for a set amount of time, is to do serology, where we look for IgM and IgG in the blood, in your blood. If you have been infected in the past, then it's very unlikely that you may have reactivation disease. However, there is a chance of that happening in pregnancy. If you've never been infected with CMV before, then close follow-up will be needed, and I will explain that in a little bit. The other thing that we're going to look at in the baby is on ultrasounds. So if an ultrasound shows a baby that's growth restricted, especially in the second trimester, having some calcifications, or a bowel that's as bright as bone, or the lateral ventricles are increased in size, then those are maybe things to think about. If you have been referred, and you should be referred to a maternal fetal medicine expert for further evaluation, and it is determined that there is a high likelihood of suspicion for CMV, then the next recommendation step is to do an amniocentesis. Usually it is done over 21 weeks and at least 6 weeks from the onset of infection. So, is there any treatment for it? Unfortunately not. It's still experimental. There are some studies that show promise of one particular medication, but I would advise that you have a very good and comprehensive discussion with your maternal fetal medicine expert to determine the feasibility of adding an experimental drug. However, we can prevent. So, here's the thing, and I know as parents we do this a lot, but take heart in the fact that, again, like I said, I think up to 80% of the adults are infected, but like I said, 50% have already been exposed. So we would say if you're pregnant and you don't know your status, try not to share food, utensils, or cups with any child, especially your child. Number two, if you're doing potty training or diaper changes, be sure to wash your hands with soap and water every time. If you are pregnant and you're not sure that you've ever been exposed to CMV, condom use, might be the third one you want to throw if you want to absolutely make sure. Congenital CMV, like I said, most of the babies who have it at birth don't have any symptoms. So even though it's something that's fairly uncommon, if you do have ultrasounds which have the findings that I've talked about, then this is something that should be considered in the diagnosis. So I wanted to thank you for coming by. This is Dr. Heather Stanley. I would like for you to stop at our website, unitymfm.com. Please leave us your email. We'll send you little tips like this and others. Find us on social media at UnityMFM. We're also on Linktree. Want you to walk good. Have a good day, and I'll talk to you soon. Bye-bye.